Hi guys, this is Dr. Emmanuel Amukun from Marvel's Dental Hospital, and today we are talking about tongue-tie, what we call Ankyloglossia. But you don't need to remember that. Tongue-tie is a situation where a short, tight band of tissue tethers the tip, usually the tip of the tongue, to the floor of the mouth, and therefore affecting its movement. And most times, mothers think that their child has a tongue-tie, yet actually the child doesn't have. So how do you know that your child has an actual tongue-tie situation? There are basically three ways you can tell if your child has an actual tongue-tie. The first is the child will have difficulty sticking out the tongue past the lower gum line, or if they have started developing teeth, past the lower front teeth. When they try to do that, the tongue simply folds and doesn't go beyond the lower front teeth. Next to that is that the child will not be able to lift the tongue to the point of touching the upper gum. Or if they are having some teeth already in the mouth, the tongue won't be able to reach the upper front teeth when they try to lift the tongue. And this tongue will appear to be notched each time a child tries any of these movements, and it tends to form what we call a heart shape. But for most mothers, you can actually suspect that your child could be having a tongue-tie situation if the breastfeeding is affected. Normally, the child will tend to not suckle for a longer time and takes short breaks during the breastfeeding. Okay, then what should you do if you suspect that your child has a tongue-tie? But before we go into that, please, if you haven't subscribed, make sure that you smash that red subscribe button right now and then turn on that notification bell so that you get notified each time I upload a video just like this one. Well, if you suspect that your child has a tongue-tie, the best thing that you can do for the benefit of your baby is to consult a dentist. Because this is going to ensure that the child gets a proper assessment, and if they have a tongue-tie, they get proper treatment. Otherwise, the community members might institute their own form of treatment, and this might cause the child other complications. So, if in fact this child is assessed professionally and found that they have a tongue-tie, what is usually done? Well, that actually depends on the severity of the tongue-tie. If the tie is very mild, we will prefer to take a wait and see approach, because there is a very high chance that if it is so insignificant, the tongue-tie will resolve by itself by the 3rd month, or at most by the 6th year. So we can also take that option and say, let us wait and see what happens. But if it is significant and it is affecting the baby's feeding and sleep and other activities of the tongue, then we will carry out a surgical procedure that we normally call a frenectomy. This procedure is very simple and quick, and usually it is done at the dental office. In fact, it is done with or without numbing, because at this point, the nerves and blood vessels in the tissue which is tethering the tongue to the floor of the mouth have not yet developed. So it is simply cut to release the tongue. And if you are like some parents, you could be asking, why should I bother myself to cut my baby's tongue? Oh, what if I don't do it? What could happen? Well, first of all, it will affect your baby's breastfeeding, because a tongue is very, very important in the process of breastfeeding. Without the tongue being able to move freely, the swallowing of the milk during breastfeeding will be affected. And if the baby grows up with the tongue-tie, it means that when their time comes to start speaking, this tongue-tie is going to affect the baby's ability to speak, and they will have great difficulties pronouncing certain words. This attachment will also result into malalignment of the teeth, especially the lower front teeth, because the attachment will create a gap in between the lower central teeth, and this is going to cause malalignment of not only those teeth but also of the other teeth. This tongue tie can also lead to poor oral hygiene, which in turn will lead into tooth decay. And as a child grows up into the teens or even adulthood, it will affect other tongue-related activities, such as licking an ice cream, being able to lick your lips, or even kissing, and other activities like playing a wind instrument. I hope I've managed to convince you that it's important to have that tongue tie cut and the tongue released to have free movements. Now, if you are wondering whether there are any complications associated with this treatment, what you should know is that if this treatment is done professionally by the professionals who are trained to do this, then there is almost no chance of complications. The complications only happen if the child is being handled by the wrong hands. And in that case, any of the following can actually happen. The first is bleeding. The child could excessively bleed if a wrong part is cut, because the area that is supposed to be cut does not have any developed blood vessels. So if it is done professionally, no bleeding occurs. However, if it is done wrongly and you cut a wrong part, maybe the wrong part of the tongue, then there can be excessive bleeding. Second to that is infection. The infection can happen either as a result of poor handling of the cut wound or by the person who does the cutting, especially if they are using unsterile instruments or it is done under unhygienic conditions. The other one is damage to the tongue itself, because instead of cutting the tie, the cut might be done wrongly and the person cuts the tongue instead of cutting the tie. And in this case, the tongue will be damaged and it also has long-lasting consequences. Close to that could be the damage to salivary glands. If it is cut in the area which is not supposed to be cut, then there are high chances that the salivary glands might be damaged as a result of that cut. Then there is also possible reattachment. This attachment is supposed to be cut in a specific way that ensures that it does not regrow and reattach. But under wrong hands, it can be cut badly and then it reattaches. Then you would have wasted time trying to cut it in the first place, because this must be redone. Having said that, I want to emphasize that the benefits of this treatment are much higher and the risks are almost non-existent if it is done by the professional. So once it's confirmed that your baby has a tongue tie, take them for proper treatment, because you don't want those consequences we have talked about of untreated tongue tie to happen to your baby. So take the child for attention, let the tongue tie be cut, and let's raise a generation of children of confident smiles. If you have watched up to this point, then I would appreciate you giving this video a thumbs up, and I'll see you in the next one.